Derek Fales. I'm the Associate Director for Developmental Disabilities and Brain Injury Services.
And Tom.
Thanks, Betsy. My name's Tom Leet. I'm the Long-Term Services and Supports Manager within the Office of Main Care Services Policy Unit.
And Heather.
Thanks, Betsy. Hi, everyone. I'm Heather Bingalis. I'm also from the Office of Main Care Services and the Long-Term Supports and Services Unit of Policy.
Great. And Craig?
Hi there. I'm Craig Donnan. I'm the project manager working under Derek Fales, helping to support the Lifespan project and the SIS implementation.
Great. Thank you, everyone, for introducing yourselves. We're being supported by Jennifer today, also from OADS. And you'll notice this is a webinar instead of sometimes we do Zoom call, other different types of meetings, in part because we have so much interest in this meeting. Right now, we have about 360 people joining. We had over 500 people register for today. So you'll notice that you don't have the capability to unmute yourselves, or we're probably not going to be able to have people unmute themselves and ask questions in this format that we're doing today. However, at any time, we welcome, as we're doing the presentation, for you to put questions in the QA box, right? There's a QA function down there at the bottom that you can put a question in, and we've left plenty of time for us to review those questions and respond to them during this session. And if we don't get to all of the questions, then we will take them back and we can add them, especially if there's a lot of similar questions. We can make sure that they're covered in our frequently asked questions document, which is currently being updated. So we're really happy to be able to talk with you all this afternoon about the Lifespan Waiver. Many of you, I'm sure, on the call have heard us talk about the Lifespan Waiver over the course of the last 4 years and in its various iterations, and the timeline that we've been working on this, what we feel is a huge systems change effort here for our system at OADS, which we're very excited about. And we have really appreciated all along the way the input and the feedback and the support and help as we have put together this program, put together this waiver. So we're coming at a time where the waiver itself will be out for public comment, hopefully soon. And at that time, you'll have an opportunity to publicly and officially comment on the waiver. But before then, we wanted to take this opportunity to give some updates about where the waiver is right now, just to share that information. Okay, so somebody's saying they can't see the interpreter with the PowerPoint up. So we have a couple of deaf folks. So how do we do that?
Yeah, so the person can pin the interpreter so that they always appear on their screen. So that would be...
It looks like it's fixed on there.
Okay, great.
Yeah,
Awesome.
I think I just fixed it.
Okay, great. Thanks for noting that. Yep. So hopefully this is all good with access. If there's a problem, you can put a comment in the chat and we'll see that too. So let's see, I lost my train of thought, which doesn't take much these days. But anyway, the point is we wanted to have an opportunity to talk about the waiver with you all so that you can hear some of the updates ahead of the formal time when you'll be able to make comments on the waiver draft, which will be out there. So today, Derek and I are going to talk through some overview of the waivers and kind of what's in it and how it's going to work for you all or for folks who will be accessing our services. And then we'll also give you some further information about upcoming public comment period. And with that, I'm going to turn it over to Derek.
Great, thank you. Advance to the next slide, please. Welcome, everybody. Again, my name is Derek Fales. today, Betsy has welcomed us, so I'm going to move over into a overview of the lifespan waiver and then continue to ensure everyone is updated on the public comment period and what does that mean. Next slide, please. So before we get into details, I do want to set the stage for why Maine is building this lifespan waiver and what is different about it. The lifespan waiver is a proposed waiver program for people with intellectual and developmental disabilities or autism. It's designed as a single program that offers innovative services across a person's lifespan. Starting as young as 14 and continuing throughout a person's life, this one waiver is intended to provide access to services that can adjust as needs change over time. And this program is overseen by the Office of Aging and Disability Services, which operates these waivers with a partnership from the Office of Maine Care Services, which is the single Medicaid agency that's responsible for supporting this waiver through the process with federal approval. I do want to talk about the difference between sections 21 and 29. A key goal of the lifespan waiver is to improve support for youth and families during the transition to adulthood, with services that can wrap around school and other systems. So currently, OADS operates sections 21 and 29. So 21 is the comprehensive waiver. The comprehensive waiver includes many services such as residential agency per diem services. And section 29 includes services such as shared living, where you would be living with a family in their home, as well as employment services. The difference between the section 21 and 29 is both waivers are separate. So if you are a youth transitioning into adulthood, most likely you would receive section 29 first, and you would go on a wait list for section 21 to seek additional higher levels of services such as the agency per diem. This lifespan waiver removes those differences and ensures that you can receive the services that you need where you're at in your life course. Next slide, please. Right now, section 21 and 29 only serves adults 18 and older, and both are for people with intellectual disabilities and or autism. Moving to the lifespan is planned to start at the age of 14 and, as I said before, continue across a person's life. The goal is to support people through life changes, like growing up, starting work, changes in your health, as your housing changes, and as your later life needs change. The lifespan services has supports to help you meet you where you're at and help you to achieve the goals and the outcomes that you want through the person-centered planning process. Lifespan will have a new rules framework based on the waiver applications, and that will be posted for public comment and then submitted to CMS for federal approval. And of course, we'll have its own public comment period too. Next slide, please.
So next, I'm going to just talk a little bit about some of the partner engagement that we've done over the course of the last several years. And many of you on this call probably fit in one or other of these groups or lists because we really have, as I said earlier, made a concerted effort to engage with people across our state, and actually nationally, we've also done a fair amount of consultation with other states as we're developing this waiver. So we've done 3 statewide tours, October 2022, 23, and then May 24. We're going to talk about this a little bit later, but we plan to do another statewide tour after the public comment this spring, just to engage with folks again out in their communities. And then this is just a list of all of the different groups that we've either presented to or gotten feedback from over the course of the last few years. Next slide. So I'm going to quickly go over some of the highlights of Lifespan. And I know many of you have probably seen these before, but since it's been a while since we've talked about it, we really wanted to go over these again. As Derek already mentioned, one of the major goals is to expand access by lowering the minimum enrollment age to 14, with the goal of improving transition to adulthood by offering waiver services before people leave school systems. We heard a lot early on when we were developing this waiver that the transition period for youth into the adult services program was a real challenge for families and individuals. And we're hoping that this waiver can help with that in many different ways. We believe that this is a waiver that will support people throughout their lives. So once they're in the Lifespan waiver, even if things change for them or as they age, they can still get the services and supports that they need in this one waiver. They don't have to wait and apply to another waiver. And that was a really important component for this waiver for us, and that we heard from when we were talking to other folks. We've a design that includes a strategy to reduce the waiting list over time, and also hopefully to help us address crises or to prevent crises by enrolling people as soon as they apply, as well as some of the other services that we have incorporated in the Lifespan. Next slide. So it will open initially and serve people where we've prioritized people who are not already enrolled in another 1915C waiver, home and community-based services waiver, youth in transition between ages 14 to 17, also adults who are receiving no other waiver services, as I've said, people who meet the criteria of being in an emergency situation or abuse, neglect, exploitation. For example, they're homeless, they don't have any other service, and they are eligible for services, then they would be able to access Lifespan if they're not on another waiver. And then people leaving institutional or inpatient settings. So those are the priorities of the individuals that we're going to be serving for that first year that we open the Lifespan waiver. Next slide. Next, in the waiver application, we put our anticipated start date for Lifespan to be October of 2026. And we have said this over and over again, but at any time, there is no requirement for people who are currently being served in Section 21 or 29 for people to transition to Lifespan. There will be a voluntary option for people to consider a process that they can go through, a decision-making process with their families or other support people to make a decision about whether or not they want to transition to Lifespan. But that will be really what's best for the individual and their families at the time that it becomes an option for people to transition. So we got a lot of feedback about this from folks across the state, and we will make sure that people and their family will be provided with some comprehensive options and some counseling to support what we hope will be an informed choice. And then service authorizations for Lifespan will be approved, at the time that they transition, so that there's no gap in those services if they do decide to transition. Next slide. So Derek is going to go into a little bit more detail, but he's going to talk about the participant groups, which we've already touched on and many of you are aware of, but he's going to go over that again. We're going to talk some about the support need levels, and how that works using tiered rates and monetary limits in those areas. We're going to talk about the comprehensive community resource coordination role and what that means in this new waiver. The increased range of services. We've added a lot of new and different types of services in this waiver. And then increased self-direction opportunities, as well as what we see as some better and more comprehensive training for direct support professionals. Derek.
Thank you, Betsy. This slide is are going to further into those subgroups within the one lifespan waiver. So participant groups are subgroups of lifespan participants who are at similar life stages, and they tend to have access to similar other supports outside the waiver. And as Betsy mentioned earlier, our frequently asked questions document will further describe these three primary groups, which include the transition age youth, ages 14 to 17, group 1, group 2, which is the youth and young adults. These individuals will continue to access school-based services and state plan services, which means the lifespan services that transition age would need would be limited to support living in their community, supporting their return to their community, and transition to adulthood. And finally, we have groups 3 and groups 4. Group 3 is for individuals who have multiple standard support needs. They're living with natural family or independently in the community, and they have access to additional services to support employment, to support access to technology and living independently, as well as individuals who have exceptional medical and behavioral needs. There are services that support those individuals as well. Group 4, which is for ages 18 and older. This group are for individuals who are not able to live in arrangements such as apartments or independent living. And this fourth group is proposed for agency group home living arrangements, so living with others in a home that's operated by a provider. Next slide, please. This slide is talking about the supports intensity scale. The supports intensity scale for adults is planned as the needs assessment tool for the lifespan. And again, our frequently asked questions documents, which is available on our webpage at OADS at .maine.gov, and we can put a link in the chat as well, will further explain more details around the supports intensity scale. It's intended to be a conflict-free, scientifically researched, and a consistent way to understand support needs. It's important to understand that the CIS-A does not decide a person's day-to-day goals. It provides information that can inform the person-centered planning team and help identify exceptional medical or behavioral support needs. Also, it's important to understand that the CIS does not include individual budgets. There are no individual budgets in the lifespan. The CIS-A may help identify the right tier for tiered services. For instance, when we're thinking about shared living, there are tiered services where providers will be paid differently that ensure that the participant who has that support needs through the CIS, that they have access to highly skilled and trained staff, and the provider can pay their staff and ensure that the person's needs are met. This really is important to help access to certain intensive supports when those exceptional needs are present. Next slide, please. Next, I'm going to talk around the comprehensive community resource coordination. So the lifespan shifts from traditional waiver case management towards this broader community resource coordinator role. This means the Community Resource Coordinator, or CRC, is a waiver service. CRCs are intended to have smaller caseloads so that they can spend more time supporting each person and less time on paperwork. There are no minimum expectations as far as billable hours. There are expectations where the CRC role emphasizes linking people to the community resources and other public programs such as education, behavioral health, vocational rehabilitation, housing and transportation, and also supporting employment outcomes and self-direction opportunity. And to onboard our community resource coordinators, we are focusing on using a competency-based training. So there are specific training opportunities that are unique to the community resource coordinators that elevates this role in its strength-based assessment and planning. And this also ensures that the CRCs have a deeper learning about social role valorization. Ultimately, the goal of CRC as a waiver service is to keep the turnover low and to keep job satisfaction high for CRCs. It's also important to note that OADS itself has been piloting this CRC role, and that is how we supported training and other supports as we did it ourselves. Further on this slide, expanding upon community resource coordination. In the lifespan, community resource coordination, again, is proposed as a waiver service. It's not targeted case management. There will be a request for proposal process. It's planned to select qualified agencies to provide CRC services with attention to strengthening that conflict-free case management. We do that through what's called the 1915B waiver application. This allows states to limit the number of community resource coordination agencies that it contracts with. An important factor is the CRCs may only serve people who are enrolled in the lifespan and may not carry a mixed caseload. This ensures that the CRC is an expert in all of the waiver services within the lifespan and can dedicate their full time to supporting individuals through their outcomes and their goals. The proposed maximum average caseload is 27. And there's also a new payment structure for CRCs, which is a per member per month. Again, a case manager in this role wouldn't need to think about how many billable hours. They need to focus on the interactions with the individual, the planning team, and supporting the member to reach their goals. Next slide, please. Next, I want to pivot to talk about the new services that are in the lifespan. As you can see from this slide, there are many brand new services that are coming to Maine, and we're very excited to talk about some of these services, many of which will be further explained in our frequently asked questions document. The lifespan provides wider and more flexible range of services to support community life, employment, and independence. Examples include community transportation, which is a separate waiver service that is separate from NET or non-emergency transportation. Community transportation ensures access to places in the community, third spaces, churches, community events where you wouldn't necessarily need to bring your staff with you. You can have transportation through this service. It also includes community supported living, which is a new housing option where you can be supported in your apartment and you can be residing with other participants who are also supported. This also includes services to help build skills for independence, like independent living skills and training. I also want to highlight the technology options that are also part of the design of the lifespan waiver. This includes remote monitoring and virtual service delivery. These are proposed to support independence and make effective use of the direct support professional workforce. When individuals can receive support remotely without a human being in the home, we believe that that will help independence and also ensure that providers can make best use of the DSP workforce. Next slide, please. Next, I'm going to spend a little bit time on self-direction in the lifespan. Over the last several years, we've heard from many individuals around expanding the state's opportunities for self-directing services. So in the lifespan, we listen to everybody. And as you can see, we have expanded many of the new lifespan services. These services can now be self-directed. Self-direction will apply to certain services, and this does allow members with support as needed to hire their own workers, as long as those workers meet service qualifications. In self-direction, the members given the opportunity and the ability to set the wage for their staff based on a percentage of the locale or the state's minimum wage. And they also can hire their staff, train their staff, and if need be, they can choose different staff. Another important feature of the lifespan waiver is individual goods and services. Think of this as if there are, as you're negotiating the wage that you're going to pay your employee, there will be savings based upon what rate you are going to give that employee. Those savings are what you would use to self-direct individual goods and services. Individual goods and services allows you to purchase services, equipment, or devices that you wouldn't normally be able to purchase under assisted technology or other waiver services that complement your daily life. Next slide, please. Next, I'm going to talk about the lifespan provider network. This slide talks about that the provider network is intended to be open to any willing or qualified provider, except how I described this in the Community Resource Coordination Service, which is limited through a request for proposal process and contracting process through the state. But for all other services, providers will need to meet qualifications by service type, such as community, transportation, or employment services, and in many cases, licensing will be required where applicable for the agency and for certain clinical services as well. And just to further talk about this, our frequently asked questions document does describe the lifespan provider readiness and further support for providers. Next slide, please. Next, we're going to talk around new and better training for direct support professionals working in the lifespan. As many of you may know, during the pandemic, the federal government provided new opportunities for states to improve the experience for participants in the waiver. We did this through designing the lifespan waiver and also supporting a new core curriculum for direct care workers training. This is for all waivers. So that opens up for the waivers for our aged and physical disability waivers or other related conditions, brain injury, in addition to the lifespan waiver. So direct support professionals, as we know, are the backbone of services. So training and workforce supports are a key part of readiness. The department has been working on strategies to strengthen recruitment and retention, including better training and clearer career pathways. Many of those are what will be available in the lifespan. So if you're a direct support worker, you will have access to these enhanced trainings to support you to help the person to meet their outcomes and their goals. Training is intended to reduce turnover by helping DSPs feel prepared, and agencies may build in time, including overtime when needed, so DSPs can complete required training. And lastly, it's important to talk about our competency-based adult education learning management system. As many of you know, the state is moving to a new learning management system to ensure that staff are fully qualified, they've demonstrated their skills, and that the workforce is prepared. I'll turn it over to Betsy.
Yeah, thanks, Derek. I'm just going to talk through a little bit of the upcoming comment periods and some of the timeline of all of this. As I've already mentioned, the 2 waiver applications. So as Derek explained, it's the lifespan waiver, which is the largest application, and then attached to that will be a separate 1915C waiver for the community resource coordination piece of the lifespan waiver. Those will be available, we hope, early next month for 30 days of public comment. Once we receive the public comments, our goal is to try to submit them or be able to submit them to CMS by May of 2026. And once we have CMS approval, or actually right as soon as we submit the waiver anyway, we'll start working on the rules that are go alongside the waiver. And there will be a legislative review of the lifespan waiver rules, which has to occur as well, following the integration of all of the comments. We will be doing lots more sessions after the public comment period over the course of next spring and through the summer. We really want people to have opportunities to engage with us more about the waiver and help us prepare for it to be implemented in a variety of different ways. We know that people will have questions about what it might mean for them. So you'll have lots of opportunities over the course of the next several months. Next slide. Yeah, so these are just sort of the next steps, which I think I already talked through. And at this time, we're going to move. Why don't you take the slide deck down, Jennifer? And we'll move. We've got lots of questions that I see in the Q&A, so we're going to move to those. The first one, Derek, is how will lifespan program impact or interact with folks approved for Section 28?
Sure. So the lifespan waiver still has the same goals to not duplicate services. So if I'm on Section 28, there may be certain services that are not available in the lifespan. So when we're thinking about transition age youth, I would continue to receive Section 28, and the lifespan will wrap around services primarily to support the family and engaging in that transition to adulthood.
Right. I'll answer the next one. Somebody asked, what are the benefits to those with 21 and 29 and switching to lifespan? And what are the risks or what is lost by transitioning? And so, as I said earlier, it'll be up to the individual and their support team to make the decision about whether or not they want to switch from 21 or 29 to the lifespan waiver when that becomes an option. And we'll have some tools that people can use in making that decision with their team. So they can say, for example, it might be that there are some services offered in lifespan that a person is really interested in accessing, and they want to be able to access those. So that might be a reason why they want to switch to lifespan. Or there's There's other reasons that people may decide, self-direction. They decide that they want to be able to self-direct different types of services, and they're not able to do that currently in their waiver. So there's a variety of different reasons why somebody might choose to switch from one waiver to another. But that'll be up to the individual person and their team. Next, do we know what the CRC caseload range will be? I confess I don't have that off the top of my head. Do you, Derek?
It's a max of 27 individuals, but the rate in the service is flexible for providers who have the contract to make sure that each of their CRCs has a caseload that's manageable, specific to the individuals that they're being served.
There's a general question about is Maine at risk due to recent federal funding cuts, and if there's anything that case managers and families can do to protect people with disabilities from possible cuts. And I would say that there have been some federal cuts to Maine Care, which have been posted about on our through various blogs. To date, those cuts have not impacted directly, at least the waiver services that we're talking about here today. They have impacted in other ways, and they will impact in other ways. And I would say the best way to answer that question would be to learn about them, and if you disagree with them, be in touch with your representatives and others, Maine delegation, et cetera, to voice your opinion about that. And I don't know if anybody else has other thoughts about that, but that's kind of the guidance that we would give around that. Community transportation, will that include, we had a couple questions about this, transportation to and from jobs? And that's...
Yes, yep. And community transportation is intended to help people to meet their third community spaces, employment, churches, and other places.
Any thoughts on how the transition would work with current community case managers moving to community resource coordinators? Since they cannot hold both caseloads, it may be challenging for agencies to hire CRCs until they can carry a full caseload, which may result in an impact. Derek, do you want to talk about that a little bit? You did talk about that in your overview, but maybe.
Sure. So we're intentional in thinking through some of those realities that agencies may face as they're seeking to apply to become a community resource coordination agency. And part of the lifespan that the rollout starts very slow. And so we have a certain number of people that will come through and receive supports through a CRC, and the transition will be slow. So that helps agencies to grow their staff, train their staff, and to plan for how that they'll be able to make sure that the CRCs can continue to only support lifespan members, and to ensure that they're separating out for their targeted case management as well.
Next question, will this impact the new Chapter 108, and will 2129 eventually fade away?
Chapter 108 is our home and community support services licensing rule. So all lifespan waiver providers will fall under this new rule. So they'll need to become licensed if they're not already licensed by the time a provider is ready to deliver services under the lifespan. Section 21 and 29 is not being planned to be closed at this time, but it will be closed to new admissions, meaning if you were going to apply for 21 or 29, once the lifespan is open, If you're seeking 29, you would now apply for lifespan and choose services within the lifespan.
And I want to be clear, we've said from the beginning that even though we're closing 21 and 29 to new folks coming into those waivers, if people want to stay on those waivers, we have developed the rate structure such that the similar services across all the waivers will maintain, will be the same. So people can stay on 21 and 29 if they prefer, or they can, when it's an opportunity, they could decide to switch to the lifespan waiver. And just so you know, we're talking a little bit more about that at our next, one of our next information sessions when we talk about how the CISA will work within the new rate structure. And that session, Craig, is, when is that? Craig Donnan?
Pardon me, what was the question?
When is the next session? Can you put that in the chat? Maybe the session that for the CISA?
Oh, yeah, sure. I'll put that right in the chat. Thank you. Yeah,
Okay.
it's Friday.
Friday the 23rd at 11 a.m.
Okay, but you can put Craig will put that in the chat for folks who didn't see it. Will staff under self-directed services, Derek, also be required to have these trainings?
There are certain staff qualifications for employment services that where if I'm self-directing, I would only be able to hire somebody that has that employment specialist certificate. The model of self-direction is that where people are hiring their own staff and they know the most about their life, and so that that person is delivering services for many of the self-directed, or delivering training rather for many of the services that are self-directed. Employment is the one where you're going to need to hire somebody that already comes to the job with those skills.
Great. Let's see. What is the new DSP training and is it being piloted?
So the new direct support professionals training is a curriculum that has been well vetted. So national experts in the field of developmental disabilities, as well as current providers in Maine and others, have already had the opportunity to review the proposed curriculum. Changes have been made as a response of that review, and we're in the final processes of finalizing the content. So once the lifespan is live, the new curriculum will better suit where Maine is in supporting our members.
Great. And the next question, Tom, I don't think we know the answer to, but I'll just ask it anyway in case you have a different answer. But for any staff that are hired to provide any type of residential assistant, shared living, or self-direction services, is that considered taxable income? And my advice would be that they need to talk to a tax professional about that, right?
Yeah, absolutely.
Okay. We have a question about somebody who's taking the training to be a shared living provider. Will they need to go through all of that training again in October when we adopt the new training curriculum, or will current DSPs be grandfathered?
There is a process. Currently, all direct support professionals do have to have a cycle where they're continuing education requirements as part of the direct support professionals. There are some trainings that are yearly trainings, and in this new curriculum, that's not any different. So any DSP who's a current DSP will continue to be able to be eligible to provide services on the lifespan, and then that person will continue to do the yearly trainings and then the ongoing trainings to maintain their certificate as a DSP.
Question, can for-profit agencies apply to provide lifespan waiver case management?
There are no differences now for who can apply as far as if you're a for-profit or a nonprofit for the CRC service.
Will someone in lifespan be able to live in the same waiver home as someone with Section 21? And yes, the answer is yes. And we'll talk a little bit more about that in our next session when we explain how the rates were developed for that very reason, because we got a lot of feedback from providers in particular that and ourselves to have a system where we have people on different waivers receiving different types of funding just wouldn't work. So yes, you can. They will be able to. Will the new training be available to DSPs providing Section 21 and 29 waiver services? Yes. Right?
Yes.
Yeah. If somebody's currently on Section 29 and they wanted to switch to the lifespan waiver, would they have to change case managers? Would they not be able to keep their current case manager?
Under the lifespan, the CRC, the Community Resource Coordinator service, which is a waiver service, that is where the state's going to be seeking a 1915B, which means that there'll be agencies that will be chosen. And if I am on Section 21 or 29 and I'm choosing to move to apply to go to the lifespan waiver, I would have to choose amongst those qualified CRC agencies. And so if my case manager is not able to move to the role of the CRC, which we anticipate some case managers will, then I potentially you would need to change your current case manager if they're not a CRC.
Section 21 and 29 waiver services still exist following the lifespan rollout? Yes, they will. All the same services in 21 and 29 will continue. Will providers who did not participate in the additional lifespan waiver training still be eligible to provide lifespan? If so, what additional trainings will be required and how will they be provided?
Many of the new trainings that are required under the home and community support services licensing rule are also trainings that complement the lifespan. So we are intentional of ensuring that through our curriculum, direct support professional curriculum, and then through our employment services training, that those are available now, and DSPs will continue to have ample opportunity to be trained so that they're ready to go when the lifespan goes live.
And will Section 19 providers and individuals receiving services in those waivers be able to access lifespan?
So Section 19 providers, any provider who is seeking to deliver a waiver service that's not community resource coordination can apply to become an OADS approved provider and can apply to deliver lifespan waiver services. And so we do look at all of those applications and all of those applicants.
So there's another question, Derek, about individuals who are 14 who access the waiver. What are some types of services that they would be able to access through lifespan other than the CRC?
So there are some exciting services that really are around peer support, family navigation, systems navigation, benefits counseling, thinking about work, thinking what that looks like at the age of 14, and services that support the youth to really help the whole family through that process of transition, which we know can be very difficult.
When will the services and limits for each of the 4 groups be available? They'll be available when we post the waiver. right? I mean, for people to do
Yes.
in depth. Yeah, right. Will all of the self-direction have the added benefits listed today, and when will those start? I think the self-direction that's available now in section 29, they're asking if all of the services that are in lifespan, will those also be in 29?
No, no. The lifespan waiver has innovative and unique services that can be self-directed, but we're not including those in 21 or 29.
And there's a great question about what has the outreach been to schools to notify some transition teams of this new waiver. They've several school districts he's aware of, and they are unaware of this coming down the line. What's the best way we can help get the word out? So we had a couple of pilots actually over the course of the last couple of years, including transition liaisons here through OADS that were funded through a grant to really try to access those school systems and get the word out about lifespan. So I'll just say that we welcome any and all ideas about how best to get information out about the lifespan waiver through the school systems, because we see them as key partners with us in this work. Because we know that the 14 to 18-year-olds are still going to be in school, and we want to be able to support the individual, obviously, within their school team as well. So we've talked about it certainly at higher levels at the Department of Ed. We've had CRCs who we currently have in our state system right now who've worked in school systems, but would love to have any recommendations that anybody can give us about how to work better with those schools or make more connections in the school systems. How is the agency provider application process going to go? Will it be through a compliance portal or a separate application portal, for example?
Great question. So we will continue to use the HCBS provider portal. And if you're a provider seeking to add new services, you would use that process to add new services for the lifespan. And if you're an applicant seeking of becoming an OADS approved provider, you would use that same portal to go through the process to become approved.
We have a scenario where somebody has a son who's currently receiving Section 29 services, and they've not applied for Section 21, asking if it would be redundant to apply for Section 21 at this time, given the wait list. Understanding is if the son wants to transition after a year after lifespan opens, then he'll have access to those services. So we're seeking some guidance about whether or not to apply for Section 21. And I don't know if this is a scenario I think that a lot of family members are talking about right now. So I don't know if you want to give a generic answer, perhaps, Derek.
Sure. I think it definitely does, Betsy, as you talked about, is very individualized decision when you're thinking about where your family is at currently and where you're looking at the future. So there is a process in the lifespan waiver and the application. We did outline what we call reserve capacity, which means that we are setting aside certain number of waiver slots that really support individuals who have no waiver services, who are transitioning into adulthood, and who are in immediate need waiver services. And then in year 2 of the lifespan, that is where, if you're on Section 21 or 29, you would be able to apply for a waiver slot. So the decision do I apply for Section 21 at this time? It depends on where the need is for your family. And 21 has that the added service of the agency per diem. And so it really depends. It's a great conversation to have with your community case manager as you're thinking about sort of where your needs will be in the next couple of years.
Another question from somebody about if people are on different waivers, can they live in a group home setting together? Yes, that is, I think we've answered that, but definitely people can exist or live in group homes or other settings across the waivers with people who are on different waivers. Somebody's asking, where are we getting the providers to implement this? And I just want to give a shout out actually to the many providers who participated in our readiness grants for Lifespan for about 2 years. And many of those providers did a lot of work with us to learn about and be ready to provide many of these new services in Lifespan. And as we said earlier, that option to access that training and information for providers who didn't either didn't know about it or didn't apply at that time for those readiness grants will also have access. So we'll provide the training. But many of the Lifespan providers, we hope, will be many of the really great providers that we have now serving folks out there in Section 21 and 29. And there's been a lot of really good interest from providers to provide these services. Will pending waiver application be converted to Lifespan application? Pending waiver.
I think this question is around if I have applied for Section 21 or 29. Well, we are continuing to review those applications, determine eligibility for the waiver, and depending on the waiver, place people on the wait list or offer them a waiver slot. And there is a process that we describe in the Lifespan waiver that talks about maintaining a person's order in the wait list from the date that they applied to ensure fairness and equity across all those who have been waiting for services.
There's a question, I think, for somebody who maybe they're in Section 29 and they apply to, actually, I'm not quite sure what that question is. Will Lifespan be able to cover the group home cost for clients who have waiver 29? I don't know if you want to, I think we're going to talk a little bit about that in the next presentation, but.
We are in the Lifespan paying providers differently to ensure that the rate that's based upon the sports intensity scale supports the person. So now currently Section 21, there's no difference in the rate of pay for somebody who agency needs to spend resources and training more for somebody who may have high complex medical or behavioral needs versus somebody else. And so the new rate structure does ensure that the provider has the resources that they need to provide that highly skilled staff and training to be successful.
We don't have the specifics, but I think in general, you could answer this question about cost differential between 21, 29 and Lifespan. And really, it depends on the services, right, that people are accessing.
It definitely depends on the services, and the Lifespan is uniquely different. So there are many innovative things that you just can't compare, such as the use of virtual delivery of services, technology, all of those brand new services that don't exist, and 21 and 29 that really support people to live as independently as possible. It also supports providers to use their DSPs differently and to focus their workforce where it's needed. So it's very difficult to really compare against those.
So will community transportation include to and from day program for those who cannot use present day disability transportation?
transportation is still needs to be utilized for access to those main care services, and community transportation really supports transportation to places where you're not receiving main care services.
Just checking on one thing. So for those turning 18 before 10/1/26, we should continue to refer to section 21, refer people to section 21 or section 29. Yes. Right. Let's see. As a children's case manager, will referrals be made at 14? So the referrals for individuals who are 14 should be determined eligible for OADS, for IDD services. And then once they're eligible, then they can seek a lifespan waiver. And at that time, there's a community resource coordinator who would support them if they have a lifespan waiver, if they're in the lifespan waiver. Anybody else have anything to add to that? Let's see. Can members apply for the lifespan waiver if already referred to section 21/29 but not yet receiving services? When lifespan becomes available, then yes. Right, if they don't have a waiver, they're not getting any services, then they can apply.
Correct. Yep. Once the lifespan goes live, there's set aside certain slots to make sure that people who do have no services can access the lifespan waiver. And if you have already applied for 21 or 29 and determined eligible, then again, we'll hold your spot by date for that waiting list for when the lifespan opens for 21 and 29.
And then I don't know who wants to answer this one, but is Maine seeking to end section 50 intermediate care facilities for individuals with IDD, ICF IDD?
No. So ICF's intermediate care facilities for individuals with intellectual disability is a state plan service. So when we talk about waiver, what we're really talking about is a person who is eligible for the ICF, chooses to live in the community of their choice supported by the waiver, but always has the right to seek services in an ICF. And so that's not going to change.
Let's see. Another question, just double checking about how section 28 is impacted if families need to decide between either lifespan or section 28.
There are state plan services. So if I'm living with my family and we're thinking about the lifespan, I would review our frequently asked questions because that does provide a guide for the family to consider around what services are available for youth, for transitioning youth, and how or what services the family will continue to access for their youth.
Are sections 21 and 29 still open to current new members until lifespan formally opens? Yes, they are. I mean, they're open for applications. Yeah. Can a family member be hired as staff if that person is already functioning as a shared living provider? I think that has to do with self-direction, but I could be wrong.
Sure. So in the lifespan waiver, each service, we do have to describe whether or not that service can be provided as a self-directed service. One of the slides that I went through, many are, and also shared living will continue to be a service that family members can provide. And then it's important as once the lifespan waiver application goes out for public comment, each waiver service has to describe who can provide it, family, and what are the qualifications are. And so each one could be variable.
Great. Let's see, is Lisa Mills on right now? Is she on the panel?
I am here, Betsy.
Oh, hey, Lisa. I'm just going to have you take this one if you don't mind, but we have a question that if we could speak to the expanded employment services under lifespan, as well as I mean, I can speak some to the working relationship with VR, but can you talk a little bit about the employment services, Lisa?
Sure. We tried to identify employment services that were missing that sometimes might cause a barrier to people moving into working in the community. So one service that was added is employment exploration, which is really important for people who maybe haven't had enough exposure to what it means to work, haven't had a chance to talk through their concerns and their fears, and have a supported employment provider actually address that with them. So that's a service. Career planning you're familiar with, that's already available. We did add work incentive benefits counseling so that if people were not able to get that from another source, they could get it through the waiver, because we know benefits are a major concern for people. We did add job development plan and outcome, and self-employment plan and outcome, so that again, if people cannot access those services from from the VR system, the waiver would be able to provide it. And we added coworker supports in addition to job coaching by an agency. Coworker supports allows an employment specialist to work with a person and their employer to reach an agreement around how a coworker or supervisor will provide the support someone needs, and that employer would be reimbursed for the lost productivity of that coworker or supervisor. So that's an option, again, that's been used in other states, and it helps with the shortage of job coaches, and helps reduce the cost of job coaching or coaching supports. That's a quick overview of some of the different services, Betsy.
Great, thank you. And we've worked closely with the VR agency. The other question was, how are we partnering with VR in this? To make sure that the services that we're providing will not overlap, or they will overlap with VR as needed. Okay. I see the note there. So actually, probably with that, we should wrap this up. Apologies to everyone. You've all asked some really great questions here. We still do have some others, and we will keep them. We'll have them here, and we'll put them together. Add them to our frequently asked questions. And like I said, there will be many, many opportunities for people to engage with us on this going forward. So thank you so much, everyone, for joining us today and hanging in there. We really appreciate your participation, your questions, and lots more opportunities will be out there for you to engage with us on this over the course of the next few months. All right. Thanks, everyone. Take care.